good to see everyone again this morning. And it's good that the sun appears to be shining, at least where I'm at today. And we look forward to another community conversation with our partners and all of our co-workers and colleagues around Central Ohio. And we've actually been excited. We've had some folks from across the state been joining us, and that's exciting as well. Let me just say a couple words of an introduction here, and we will get started pretty soon. My name is Jesse Schrader. I'm one of the deputy directors with Building Better Lives at Franklin County Family and Children First Council, and I work in our trauma-informed care community training departments. Let me introduce a few of my colleagues that are with me here today. We also have Debbie Holycross. She will kind of wave and say hello there. And she is another one of our deputy directors on our trauma-informed care Building Better Lives initiative. We also have Eve Fitch is with us as well, and she works in our REACT program, actually connected to the REACT program here in Columbus, which is the opioid response unit, working with first responders and the fire department here in Columbus, responding to the opioid epidemic. Eve, are you with us here today? I know I saw you briefly there.
Yeah, I'm here.
There you are. Good morning.
Good morning.
And I also just want to bring some recognition to, before we get started, acknowledging our agency leadership as well here at Family and Children First Council. Jane Wide is the director of our agency, and Julie Bizard is our assistant director. And together, Jane and Julie have really paved the way for us to be having these trauma-informed care trainings and conversations. And we're so appreciative of their work of bringing brain-based trauma-informed work to our community. So they are also with us on this call and will probably be jumping in at some point as well. So this morning, we are so glad to have everyone here. We've been doing these community conversations for a few weeks now. I believe this is our 5th or 6th of this series. And we really hope and encourage that these are conversations, that these are open, and that there's participation and engagement. So if you're present with us today, we invite you to offer some comments in the chat box, to say good morning, to ask a question, to share an idea. And that really livens the conversation and brings the community together, which is the purpose of these meetings. Of course, we invite you to stay muted if you're not talking, to kind of keep that sound going well. But if you have something that you'd like to contribute, feel free to unmute and just say, hey, excuse me, can I jump in here? And you are more than welcome to join in the conversation as well, whether that's in the chat box or unmuting and being part of the conversation here. Our topic for today is this idea that we are in the storm together, but we are not in the same boat. And this is based upon an analogy and a metaphor that's been drawn and been talked about, recognizing that the COVID-19 pandemic is hitting everyone very differently. And I'm just going to let folks know that I will be sharing the community message that we wrote about this topic in the chat box, so you can download and access that if you haven't already seen that. But to kind of introduce this topic, I do want to just invite Debbie to kind of share a little bit about how we sort of started talking about this idea and how it started to come across, at least in our agency. I know this isn't unique to us, but how this particular aspect and factor of the pandemic that we're going through. So Debbie, I'll just kind of turn it over to you and invite you to share your thoughts on this idea right now.
Sure. So this kind of came up, it started as a conversation between Jesse and I think, on the phone. And I was driving, I'm sure you've seen all the billboards on the ODOT billboards, right? On the Outer Belt and on 70 and on 315. And it was that we're all in this together kept popping up on the ODOT billboard. And we were talking, and it's not so much about breaking down that we aren't all in this together, because we absolutely are. And that message of solidarity is really important. Especially as we navigate uncertain times like we're in now. But it was really around, sure, we're all in it together, but are we really all in it together the same? And so we started to kind of talk about that and bring recognition to the fact that this doesn't look the same for everybody going through it, and some people are experiencing this a little harder than others, and all of that. And so again, it wasn't to tear down the message of solidarity, because we absolutely are all in it together, but what that looks like just kind of varies. And that's kind of how we started talking about it. And from there, we went in all certain directions, as we typically do in many of our conversations. But as we were talking about that in a bigger team way within our agency, I think it was Julie who brought up the analogy of being caught in the storm, but that while we're all in the same storm, right, the pandemic being the storm, we're not necessarily all in the same boat. Your boat may look a little bit differently than my boat and my circumstances. We're kind of calling that our past experiences and our current resources kind of impact and shape what our boat and our ability to navigate the storm looks like. And so that's kind of that analogy we've been taking as we've been looking at this we're all in this together mentality. That's a little bit about how we got here and why we thought this topic would be great to bring to our community today, just because we know all of you, in some way or another, you're all trying to function and do your jobs, and how that impacts you versus, say, your coworker, your supervisor, your family members, all looks different. So we just wanted to bring recognition to that.
Yeah, thanks, Debbie. And I think that this topic and this metaphor is so relevant and connected to trauma-informed care as well, because we know from our work with clients and families and in our own personal lives that different experiences are interpreted and responded to very differently. And one of the common experiences that we'll have, whether we're in a school setting or a daycare setting or a hospital setting, there is a common experience, but 2 or 3 individuals will respond very differently, and there can be a misunderstanding or a misperception or even a judgment of that behavior. But the essence of trauma-informed and brain-based approach is recognizing that past experiences shape our brain, and the current resources that I have are going to either empower or limit how I'm going to be responding to whatever is going on in front of me right now. So I'll just take a minute to touch base on a couple of those ideas around at least these 2 factors of past experiences and current resources. And that's really a simplification. There's certainly more that goes involved into how we're responding, but at least from a general perspective, this is an introductory way to kind of think about how an individual's history shapes their brain and shapes, in particular, their stress response and their ability to respond to whatever that crisis is in front of them. And we've primarily learned this from the Adverse Childhood Experiences Study, or the ACEs study, which probably many of you are familiar with and have heard us talk about before. This image that you're looking at right now can be found on the cdc.gov website, where they talk about the Kaiser Permanente ACEs study. And right in the middle there, you can see how the adverse childhood experiences lead to that disrupted neurodevelopment and the social and emotional and cognitive impairment. So the adverse childhood experiences that really are a way to sum up trauma or toxic stress or negative experiences in childhood cause that disruption of attachment, of brain development, of social skills. And so recognizing that any trauma that we experience impacts us both emotionally, it obviously impacts our feelings, it impacts our relationships, but it impacts us physically. And that's primarily recognizing that it impacts us through our stress response system, that our levels of adrenaline, our ability to kind of kick into that fight, flight, freeze response based on whatever stress is coming toward us. And so that history of adverse experiences is going to cause my body or my brain and my response to be more intense. It might put me either at a greater risk or better prepared, depending on my exposure to stress in my history. So additionally, that's going to impact then how my social well-being and my engagement with my community around me is going to be. If I have those early experiences of adversity that have led me to, perhaps have incarceration or not to have graduated or to have, physical or mental health conditions. All of this social functioning is part of that history that leads up to my ability to engage in the present moment and respond to that threat. This is especially true and what we're seeing now in the COVID-19 pandemic in regards to marginalized and oppressed groups. We're seeing that the rates of infection and positive testing for COVID-19 are higher amongst people of color, amongst African Americans, amongst marginalized groups that over time and over generations have not had, whether it be access to healthcare or more stress and more chronic physical conditions. And so we're seeing that groups of people that have been under systems of oppression and systems of marginalization creates that stress that leads to a higher stress response, whatever that threat is that may be universal, but a different person is going to be experiencing that differently. And so that a way to sum that up would just be to say that that history of adversity also then leads to fewer resources and fewer advantages in the present situation. It's kind of a lot that I just sort of threw out there. So I'm going to pause the screen sharing here and invite Debbie and Eve maybe to jump in, or if anyone has any questions or comments about that as well.
So I wanted to point out that, you know, when you talked about that, it's the, you know, that adversity, that last bullet, you know, it's not saying that it's adversity kind of, you know, when we look at the ACEs, we look at childhood adversity that is, you know, abuse and incarceration of parents, and it's related to their own personal experience. But I want to point out that what we're experiencing right now is really important to those marginalized populations who may not have experienced personal adversity, i.e. abuse, neglect, anything like that, but they have experienced being marginalized, and that's really important to recognize, that then it's led to a lack of resources potentially. And you know, I think accessing resources right now, we have communities who have been pretty savvy about being able to access resources. This is a whole new ballgame. And when you talk about communities that may not have access to internet or to the ability to connect via an internet, they're really being marginalized because they're not even getting the information about how to get resources.
So, hey, can you hear me from out of May?
Go right ahead. Thank you.
Okay, so I was just on a call with, I'm on one of those committees with Columbus City Schools, the partnership committee. And I'm on a subcommittee, which has supposed to support students. And so what Eve just said is so accurate. Right now, Columbus City Schools assigned email addresses to youth after they had already exited the building. So the students that got the email addresses, it wasn't one that they chose, it was one that was assigned to them. But the other problem with that is each family got one Chromebook. And if you do the math, you know, with 50,000 students in their district, there are going to be a number of families that have more than one child in Columbus City School and more than one in a different kind of grade. Like you might have an elementary one and a middle school one, or a high school one and a middle school, or whatever that breakout is. The other issue with that, though, is, again, they got the Chromebook after they were out of the building. So if you get an email and a Chromebook, and now you got to figure out how to use it. And if this is not within, was not within what they were already doing, and especially the parent who also now has to join in and ensure you get homework. And I now find out that to access certain components of their lessons, they're on more than one platform. So what Eve is saying is so accurate, that if you can't figure out how to use the Chromebook, and then secondly, you got to figure out how to access the different platforms that you need to get on in order to find out about your homework or your lesson, or to be in class time, and then try to figure out how to do that work. So at the same time, some of these families, parents have to report to work because they're considered essential in the industries that they're in. And at the same time, now the sibling or one of the siblings have to provide childcare to another sibling, and also try to figure out how to help them with their homework. I think that's classic. And the libraries are closed, which is their average resource. And their friends, who is another resource, is not accessible. And the after school programs are not necessarily accessible. So I think what Liz is pointing out is so accurate in what's going on right now in Columbus and in Franklin County.
So Nettie, you said some really important things that I want to point out, that, that children are watching children and helping them learn, and that, they don't have access to their friends. So we've heard a lot about how much this virus has hit people of color. And I feel like there's a little bit of a pejorative kind of piece to that, which is really distressing, because if you are an essential worker and you're going to work and your kids are at home, you know what? You may be having a neighbor watch your child. You may need your children to go to their friend's house because you don't have any other resources. So when we talk about the spread of this virus, it is related to poverty, it is related to those marginalized, but it's really thinking about their situation right now. And that is, you know what? I need my social connections to help me manage, because I'm still working, I still have children to feed. And so I think it's easier to spread that based on all of those complications.
Thank you for sharing that report out from Things, Nettie.
I would just add one thing as well. When we talk about the marginalized groups and the historical piece, the historical trauma and generational trauma, I've heard talk about that there's a weathering effect on the body for groups who have been historically marginalized and oppressed. That stress is constantly there. It's like a baseline kind of stress level that these groups experience, and that causes stress on the body and a weathering of the body. And so that makes, that's another reason why these marginalized groups are experiencing higher rates of infection, because that stress has worn down the body to a degree that makes them more vulnerable.
Absolutely, Adrienne, and that's really hitting on that, that historical piece. I think we've sort of touched base on both of these things now. And so thinking about how, and I think this ACEs pyramid is just the way that kind of sums this up, of recognizing that historical trauma is the underlying factor that creates that weathering and that toxic stress that leads to social conditions of not having access to resources, which then becomes that sort of cycle that feeds into, if I don't have those resources, whether it's electronics or healthcare or whatever that may be, the likelihood of more adversity as a child then leads to those physical and social disruptions. And so that pyramid kind of moves in that direction. And very sadly and very tragically, and we're seeing this firsthand, but we've seen this in many ways for a long time, the top of that pyramid is early death. And the statistic has shown that a child born in Flint, Michigan has potentially a 20-year lower lifespan. 20 years lower of life. And that's just due to the social conditions, the context, and that's been a generational thing happening in a community like Flint, Michigan. But we're seeing this also now as well across the board with COVID-19. So we talked about that impact of adverse experiences, and we've been bringing up the access to the current resources. like Nettie shared, like Eve was touching base on, whether that's employment and income, what resources do I have for employment? Am I employed? There are many folks who unfortunately have lost their jobs due to this situation, and there are folks who have to continue to work and are not able to work safely from home. Do I have the resources of physical and mental health? If I have a history of as someone mentioned in the chat box there, of depression, of anxiety, and now there is a massive global crisis, is that lower resource of mental and physical health going to impact me currently? And then, of course, in this situation, because it's a health crisis, do I have insurance? Do I have access to healthcare? And that, that phrase, access to healthcare, that's so complicated in so many ways. And whether that means being able to see a doctor that my insurance is covered, getting the quality care. Stable and safe housing, this is going to be a challenge that our community is going to be facing firsthand very soon as we start to kind of reopen, and we have to face things like evictions and rent and many of those things that have been put on hold for a few months, which was good, but those don't go away permanently. And someone else also mentioned in the chat box about isolation is a resource, having those relationships. So if I am alone and I don't have access to a support network that can provide many different things for me, so whether or not I'm able to check those boxes of that access to current resources is going to impact how can I weather the storm that is coming at me right now.
I think we had a couple of other really good comments in the chat box here. I just want to make sure I read them out in case people missed them. One was that there's a certain level of infrastructure that was never established for certain groups of people before the pandemic. So now, obviously being in it, not having that prior, we can't really create it now. That's a good point. And then also that in Franklin County in particular, the comment is that residents who, on top of all the other issues, don't speak English either as a first language or at all, so have even more limited resources available to them. And those are things I don't think we should lose sight of.
Absolutely.
So it's a little overwhelming to think of working to support this population with the information that we've been sharing the past few weeks, which is really wonderful information, and I have been sharing it and it's been appreciated, but also balancing that with knowing so many of these people are, like we're talking about here, like on an island of childcare, teaching, doing their own, mine are adult learners doing their own learning and having to go out into high risk essential jobs, almost all of them. It's so much. I'm just stunned at people's ability to function. This is a really spectacular crisis for so many of the people that I work with and probably other people.
I always hope that we begin, this just highlights, I think, for me personally, it has highlighted my privilege to be able to travel across Franklin County to get resources that I need because I have a vehicle, to be able to, have food in my fridge because I have an excess of freezer space. And so I'm able to buy and go, infrequently. I also have the money to be able to do that, to go buy large quantities. Folks are having to make those trips because they don't have the money at every given time. So it's just really highlighted, I think, for me, the privilege that I have, especially now, to adhere to the social distancing recommendations. And I just don't think that our marginalized populations have that ability right now. And it makes it just so much more complicated. And I worry now, too, that you kind of see on social media the kind of the response and the shaming if you're not socially distanced, if you're not wearing a mask, that folks are kind of getting up in arms about that. And I worry a little bit about how that will impact our marginalized populations as well, because I just don't know that they have the resources. And I also just, because of that just everyday life stress, look, I'm worried about getting shot in my neighborhood. I'm not so worried about this damn virus that's coming down the pike. So I'm not going to wear a mask. I'm not really concerned about that because I have other concerns to be worried about. So I'm worried about how that will play out in the months to come.
I was going to share a story about that, Eve. Thank you for the segue. So my significant other and I talk about these things a lot, especially as you were kind of talking about those other factors that play into this. And we were talking particularly about mask wearing and the perception of that. And he, as an African-American male, comes from a community, grew up in a community where armed robberies of grocery stores is a nightly occurrence, and gunshots in the neighborhood. Those are just traditional things that were happening. And so over the weekend, he went to, go socially distance, say hello to his mom for Mother's Day. And she asked if he would go pick up his groceries. And she still lives in that neighborhood. And he struggled a lot as he drove to the grocery store to decide if he was going to wear his mask or not. And the thing he said was, I want to stay alive, but I want to stay alive. And it was, I want to put that mask on and protect myself and others around me, but I also don't want the perception to be a threat. And both people in that instance, him and the grocery store clerk, who has had that happen a lot, armed robberies happen a lot, and now everybody's coming in a mask. I can't imagine the stress level that individual is feeling, plus the marginalization of being caught in having to decide if you're going to put that mask on or not, or will you be perceived as a threat. He decided he could only purchase like the surgical masks so that there was no way it could be misconstrued or looked at as something that would be threatening, because that's a real fear. And so, we talked, Jesse brought up like the disproportionality in our death rates in communities of color. And I have to wonder if that plays a factor in that as well, just because is it part of that, the perceived threat of wearing protective equipment? It's just, yeah.
Thanks for sharing that story, Debbie. Yeah, it kind of hits home in a lot of different ways.
I was just going to say, I've seen even as this thing has started with the mask wearing, some disparities in how people are treated. I don't know if some of you have seen maybe some of the videos and images and stories out of New York, where like in Central Park, we had officers handing out masks to folks in the park. And then like 5 miles away in a Black neighborhood, police officers were arresting people, throwing them to and doing all of that stuff for not social distancing or not wearing a mask. So we already see that there's a difference in the way communities are being treated with regards to wearing masks and social distancing.
So I think this is a great time for us to kind of move the conversation forward just a little bit, and just kind of summarizing, like we said, that we're together in the storm, but we're not in the same boat. And so those past experiences are, one way to think about it is that impacts kind of the size and the condition of your boat. How prepared am I to weather the storm? Do I have, a savings account? Do I have safe housing? And my current resources shape how I can navigate the storm, and how I'm being responded to. And all of these examples that folks are bringing up are absolutely 100% relevant. And there's really value to hearing these stories so that we can build awareness as to how we are going to respond and how we are going to weather this storm moving forward. And knowing that this is an example of something where everyone has a unique experience of it, we want to try something a little bit different. We want to try a breakout group discussion. And so we are going to take about 7 minutes to move into a breakout room experience here. So
there's just lots of those populations that are wound with that heightened stress response and that heightened hypervigilance right now, especially in this kind of pandemic. And all of us as individuals, regardless of what gender, race, creed, religion we are experiencing and weathering this storm a little bit differently. So just going into this conversation coming up in your breakout groups with that kind of a mindset.
Thank you. Yeah, I appreciate that clarification. We will, just kind of take a few minutes to let folks sort of share out any parts of the conversation that they were having in their group, and I just want to, recognize that again, even just the topic and the content as we're discussing here, that this is something that's going to hit everyone a little bit differently. It's going to be challenging for folks. So if this is something that's you're feeling maybe a little bit more personally and significantly, we just want to recognize that and give everyone space to do what they need to take care of themselves during this discussion. But are there any folks who would want to share and report what was kind of talked about, either stories or examples that maybe were shared in their small group discussion?
I wouldn't mind going. I spoke with Marianne. Sorry if I got it wrong. And she was saying that she's in Franklin County. I'm up in Erie County. And I didn't think of this until she said it. But like people who don't speak English, trying to understand the governor's orders, and then like the whole reopening, everything that they've already been going through is like compounded, like just the programs they'd have to apply for, and maybe it's not in their language. Like I didn't think of that. I always said that would be, I couldn't imagine if I didn't speak the language and now all of a sudden everything's closed, you're not allowed to work, you have to stay home. And then, okay, now we're gonna open, how are we gonna make sure everyone's safe? So that was, it makes sense, it makes total sense. I just didn't think of it because I speak English.
Yeah, thank you for sharing that. I think the relationship to the government is one aspect of this that, again, is one where past experiences are really going to impact how you're going to currently respond to a situation. And for some individuals, for some groups of individuals, the government is a trusted source of information, is a trusted resource, and it is something that we can rely upon. And for other individuals and groups of individuals, that's not always the case. And so what those messages are and what those recommendations are, and whether, I can even understand it in my language or not, is a huge impact for sure. Any other folks want to offer what was shared in your group?
Jesse, our group, I think what I took away from my group is that, there's kind of these two worlds. We have our work environment, and that's creating different kinds of stress. And then there's the personal environment for each one of us that has different circumstances that create a whole nother kind of environment, and that it's kind of the two of them. And I think a lot of folks are recognizing the differences in populations and what they might be going through, but feeling pretty powerless about doing much about it. And that's pretty difficult sometimes.
In our group, we were speaking about, I work with a population of refugees, mostly from Somalia, and the language that the parents speak is Mai, and there's actually no written language. So they don't have any way to reach this information unless it's through secondhand through their children who speak English. One thing that I also mentioned, noticed in our group is that we all seem to be, in helper professions, and ourselves didn't really come up very much. It was mostly about our concern for the populations we work with, whether it be family and children's services. We're worried about losing children right now because the court systems aren't running readily, and some of the areas that we are normally able to enforce, we're just not able to do that right now. Like for my population, the refugee population, there aren't ways to really to support them unless we're there in person. So yeah, it's been tough.
Yeah.
Jesse, in our group, one of our members was sharing how everyone in her immediate family is an essential worker, and they're basically just waiting to see who's going to get it first, and just living under that constant threat of this virus because everyone is an essential worker. So that just the weight of that.
Absolutely. Yeah. Thank you for sharing that, Tamara.
In our group, oh, go ahead.
Sorry. One thing that came up in our group that just kind of struck me was about mask wearing and people who have experienced trauma, maybe a sexual trauma where their mouth was covered. Having a face covering like that is unbearable for some. They're just not able to do that because of their history of trauma. It's just something that I hadn't thought about. And it's so true that some people will be triggered having to wear a mask and won't be able to. So.
Yeah. Thanks for that, Adrian. Saw a couple other folks that unmuted, maybe Laura and Joanna, you're welcome to chime in as well.
In our group, one of the things that we were talking about was just hoping that, you know, for ourselves and for the people that we work with, some of us are, you know, providing direct service to marginalized communities, and others are kind of indirect, but hoping that there's just like an increase in empathy. We have entrance to, in some ways we're separated more than we've ever been, and in other ways we have this weirdly intimate entrance when we are talking to clients on video conference and they're at their houses. We might not normally be in their home, or for teachers who are seeing kids you know, on Zoom in their living room with siblings around. You know, we are seeing sometimes more than we might normally in our context. And so just hoping that we have greater empathy for one another as a result of this time. And then also thinking from our positions of relative privilege, how difficult this season is, even for those of us who haven't experienced loss of income and everything is pretty stable, how hard this still is for us. And so thinking about if we start stripping back those privileges, how much more magnified and intense the stress would become. And that's what a lot of people that we work with or interface with are dealing with every day. When someone was mentioning about, Tamara, about feeling like they're just waiting for the virus to hit. I talked to a student and his mom is a nurse in a correctional facility. And in this conversation, he was just like, well, this person got sick and then this person got sick and she was staying with this friend, but now that friend is sick. And it felt like he was being chased and you could just feel the intensity of that like anxiety. And that was really illuminating for me in how close it feels for some folks who are out in the world every day. So, yeah.
Absolutely. Yeah, thanks.
There are a couple things in our chat box too. I just wanted to make sure we read out. Joy had mentioned, I think this goes along with what Eve and Jen, you were kind of saying with the struggles with privilege, but understanding that we are doing our best and need to remind ourselves to give grace. That came up in her group. And then Karen wrote, there seems to be growing divisions among people and even groups of close people as to what we need to do or not be doing, even seen in her church, and what precautions are needed and what we can, quote, ignore. Let me keep scrolling here. And then the issue of sensories. Yeah, Tamara, you brought up sensory wearing with masks, especially for children. That's a big one as well. It's, I think it goes back to that bringing empathy, right, to the need of not everyone can wear a mask because A, triggers, or B, sensory needs, or C, past experiences that have shaped their present. There are just a lot of factors in that. So bringing empathy and giving ourselves grace and giving people around us grace as well.
Yeah, and it's great someone shared out that social story about how to help folks understand the importance of wearing a mask. And so that's in the chat box there about some visual examples and kind of reading through the story to help either young children or to help visual learners understand the importance of wearing the mask. So thank you for folks sharing that resource there. It's really great.
Something that came up in our group too was there's kind of been a lack of shout out to kids in all of this. They may not necessarily be part of a marginalized population, but they're being isolated in ways that they never have been before, and there's not necessarily a real understanding around the why. I mean, there's only so much that they can process and understand in terms of why all of this is happening. And so it was kind of just overnight, everything had been taken away from them. There is no school, there is no sports, there is no going across the street to see your friend, there is no stuff open that we can go do. We can't even go to the park or the playground, and not really, as a parent, knowing how to talk through that and those kinds of things. So there's just kind of been a lack of a shout out for the resiliency that kids have exuded, I guess, in going through all of this as well.
So we just have
I think that goes back to some conversations we had a few times ago about trying to provide information to parents about the value of predictability and scheduling in breaks and fun. Because I think, starting off, a lot of kids are just at loose ends. I mean, you've got the school piece, but that's a piece of life, and that predictability is helpful.
Absolutely. Thank you, Nancy. A couple other discussion questions to put out as we sort of start to move towards wrapping up our time together. And this is a conversation that I think we could really have for quite a while. And before just kind of trying to provide an easy solution to things, there's not an easy answer, an easy solution to this situation. And I really just want to give recognition and honor as much as possible to those individuals who know somebody personally that they've lost to COVID-19. And we just feel for you and feel with you and recognize that this conversation is very personal and is very difficult for so many reasons. I would love to hear from folks about ways that they are finding how we can recognize and honor the experiences of others, how we can use our own resilience factors to help others weather the storm. A good friend of my family volunteered to be a nurse, a traveling nurse in New York City, and just connecting with her and hearing her stories and having her share, a photo of herself and sharing that with our children, and our kids say she looks like a superhero because of the mask that she's wearing, and telling her just how much respect we have for her was just one example of how we were doing our best to recognize and honor the experience that she was having, that even though for us, we are thankfully safe and not experiencing it firsthand in our home, but every day she was on a pediatric unit caring for kids with COVID-19. So I would really be eager to hear from other folks as to how you're finding ways to recognize and honor the experiences of others, and how we can together those resilience factors that we're regularly talking about, of connection to community, of perseverance, of self-regulation, of that sense of hope, how we are using those resilience factors to give back and to support one another.
Hello.
Hi, go ahead.
Hey, just wanted to say, my name is Dante. I work for Franklin County Children's Services. But just the other day, I also work for the YMCA part-time, and we did a food giveaway, partnered with the food bank, and had to drive up to help those in the community to support them with food. So that's one way I was able to recognize what people are going through and to help them out as well.
Awesome. Thanks for sharing that.
I've been sponsoring Zoom meetings in so many different directions. So for church, we've done Zoom meetings for extended family. And then last night, my 83-year-old mother lives alone, and many of her peers also live alone. And they were talking about canceling their book group. And Mom's was like, I wish I had Zoom and so I could do it like you do. And I'm like, well, Mom, I can run your Zoom meeting and I'll just clean my desk while y'all chat. It was the most hysterical thing. So we had 15 women in their 70s and 80s, and I think one was 90, who some had never been on Zoom before. But, you know, to come together and to talk, and one woman had lost her husband Friday. And some of the other ladies were asking her about it, and she's like, no, I don't want to talk about it. I just came to the book group to have something fun to think about. Let's talk about the book. So just helping them pull together and have a meeting so they could chat. I told my wife it sounded like magpies in the room. I'm not sure anybody heard anything, but they enjoyed themselves.
That's awesome. That's a great story. A couple of things that, oh, go ahead. No, maybe not. Well, a couple other things that folks were sharing in the chat just about, you know, bringing food, like Dante was saying, you know, whether that's through an organized thing with the food bank and the Y, or kind of individual opportunities to bring food to folks. Some of the high school teachers delivering pizzas. You know, our family's been trying to connect with some of the students that we continue to work with, and dropping off that pizza. And what I've heard from folks is, you know, it's not that, you know, not that they couldn't get a pizza for themselves, but it's the message that comes behind that action. And that's really what any kind of a social giving action, there is the need, and we try to meet that need and work for that. But when it comes from a person, the message that comes from that carries so much more meaning and significance than the item itself. And that gives that sense of hope. That gives that connection to community. It's not just about an item that I can get for free from a generic, non-personal source, but that somebody with a name and who knows me comes and connects with me. So, Debbie, were there a couple other things in the chat there that you wanted to read out, and then we'll close out here together?
Sure. Other ideas people had, Beth said their agency has made about 1,200 masks so far. Kudos. Nettie says emailing cards to ministers who are supporting families. Laura said that Columbus City Schools has a Facebook group sponsoring graduating seniors with gifts and surprises. And then we've also got from Jamie Cornick, I think it's Jamie, right? My director went around to all of the direct service providers and gave them goodie bags, thanking them for providing services for our people right now.
That's awesome. Yeah, and it looks like some folks are interested in finding that Facebook.
Groceries.
Yeah.
And, yep, lots of good ideas.
Yeah, folks are interested in finding that Facebook page. So Laura, if you have that there and can share it in the chat box, and we'll leave the group open here that we can try to find that together. And yeah, I love that about sharing groceries with neighbors. You know, even that are some ways to connect in that immediate community, people that are around you. Appreciate everybody.
Go ahead.
No?
You want to? Okay. I was just going to say that we hope that, I guess, over this last hour, you know, we always hope in our conversations that we shift our perspective a little bit and we bring, you know, new thoughts around. A lot of times when we're talking trauma-informed care, we're talking about changing our own brains too, not just by our past experiences, but continuing to shape our brain. And so we hope through this conversation, we've been able to shift perspective just a little bit. And we've loved having the conversation, and for everybody being a part of it and being a responsive part of it, and contributing all of your truths and perspectives too. It just helps us continue to understand. So thank you for being a part of it as we continue to seek and empower individuals to have the resources needed to survive this storm together. And, you know, we'll go back to, we're all in this together, because we are. It's just bringing recognition to the differences that also exist in that space.
100%. Thanks, Debbie. And we're going to continue to be sharing messages with the community. And so if you want to receive those emails, you can put your email in the chat box there. Please check your spam or your junk email folder. We are using a new email service, and sometimes then those kind of get sent into that spam folder. So check to make sure that we're on that approved sender list. And we will be here again in this space and time again next week. So keep an eye out for that. You can always send me an email directly, or you can email our general help email address there, information@helpmykid, or my email is jesse.schrader@escco.org if you wanted to get any of the past messages, or we also are recording and sharing these meetings as well and are available on a YouTube channel. And so you can go back and view those or share with coworkers. We absolutely appreciate all of you. Thank you for taking the time to be with us here today. Your time is incredibly valuable. Your attention and the work you do is incredibly valuable. So hopefully this has been encouraging and empowering to you in some way as we all continue to go forth and are resilience builders in our community, and responding to the needs, and just partnering together as we join together in our community to continue to fight this crisis, but also to grow stronger together. Thank you to all of you. Have a great rest of your day.
Thank you.